Hello, my name is Andrew Robertson, and I'm going to talk a little bit today about the pathophysiology of breast cancer as well as signs and symptoms of the disease. And when we talk about breast cancer, it's important to know that it's always caused by a genetic abnormality. This is a defect or mutation in the genetic makeup of cells. Now, surprisingly, only 5 to 10% of breast cancer is caused by inherited genetic abnormality. Leaving the majority of breast cancers to be caused by the standard typical wear and tear, aging of the cells. It can also be caused by environmental factors such as exposures to chemicals or radiation, or sometimes people theorize additives in food, though the research is still out on that. Now, when we talk about breast cancer, it's also important to think about the point of origin. Where does the cancer originate in the breast? Well, the milk-producing glands and the passages that carry the milk to the nipple for discharge are the two typical points of origin for breast cancer. And we can look at this diagram here. We can see the lobes that produce milk and the ducts that carry to the nipple. Those are the two main sites of breast cancer origination. It typically doesn't originate in the fatty tissue around the breast. Cancer usually has a structure that it originates in, and for breast this is typically the lobes and the ducts. Now, when the cancer stays within these structures, we call it non-invasive, and the term for that is in situ, meaning in its original place. So the takeaway from this is that breast cancer originates in the ducts and the lobes, and that when it is confined within these structures, it is called in situ. Again, here's the diagram, and when breast cancer spreads outside of these structures, it typically will come into a point that's close to them, such as the lymph nodes. And it can also start in the lymph nodes sometimes. We'll get to that. But as we go over to the lymph nodes, we're no longer in situ anymore, and we're looking at invasive breast cancer. And when this happens, we need to assess the cancer more. We need to look at the breast and do some scans, such as a CT, maybe a PET scan, and that'll give us just kind of a better idea of how widespread the cancer is. If there's lymph node involvement, as you can see, below the armpit is the largest concentration of lymph nodes. There are also some across the chest and underneath the breast as well, but the largest concentration is under the armpit. And when it gets there, we can do a scan to count, see how many lymph nodes are involved, and from that we can look at the number of lymph nodes. We can see if there's a primary tumor in the breast that originated from, and we can measure those things and give a grade to the cancer to determine a better diagnosis and treatment plan. As you can see here, when cancer spreads outside of the breast to another structure, we call that metastasis. And metastasis simply means that cancer that has spread to another site. As I said earlier, it typically spreads somewhere around the breast, such as lymph nodes, but other organs would include the lungs, the liver, and even bone cancer, bone metastasis such as the spine. So it's important that we get that diagnosis to find out where it has spread to and where the primary cancer is so that we can treat that. Now, as far as signs and symptoms, it's very rare to experience no signs and symptoms of breast cancer. It does happen, but it's very, very atypical. Typical side effects would be the lump. On self-exam, some people may find a lump underneath their armpit, underneath their breast, on the breast, and this is typically the first thing people notice when they have breast cancer, just on self-examination. And then also nipple discharge is a possibility because the cancer can typically originate in the ducts and lobes, as we said earlier. And when that happens, it is common to have some discharge that may contain traces of blood. Also, another symptom is an inverted nipple. Instead of sticking out, it actually goes in, maybe soft and inverted. Also, the lymph nodes underneath the armpit or across the chest may become red, tender, or swollen. So that's, along with the palpable lump, would be an easy symptom to find. Also, another one that is possible is dimpling of the skin. Instead of the skin being skin being smooth, it may have some dimples, some little indentations across it, and that's always something worth checking out as well. So, if you see any of these symptoms, be sure to follow up with your primary doctor just to get a second opinion. They may order some scans just to decide it may be benign and no action may be necessary. But it's important that should you notice any of these, that you do follow up with your doctor. It's important not to wait around. Go get it checked out. And, hopefully they'll put you through and get you a scan and everything will be fine. But, if not, then we've had to plan for that as well. So, if you notice any of these, contact your doctor. I hope this information has been helpful. Again, my name is Andrew Robertson, and this has been a presentation on breast cancer, pathophysiology, and signs and symptoms. Thank you.